over in the pile of face, though. I'm going to need you to sign a consent form. I'll grab it and be right back. Yeah.
I'm sorry I didn't put on the gown. I know I'm supposed to. But it would take me forever at the moment.
Cut you some slack.
I'm also kind of hoping this won't take long. Ryan has had perfect attendance all year.
Oh, well, as an alumna of the Perfect Attendance Club, I will do my best to get you both out the door. So, Sarah, you got dizzy driving to school today?
For like a few seconds. Yeah, I pulled over to study myself for a moment, and then I felt fine. But my worrywart over here begged me to turn around and come here.
She gets dizzy a lot. Sometimes she has trouble catching her breath.
I have to park on the street. I get a little winded sometimes walking from our apartment to the car.
Every day?
I tried to explain to Ryan it's normal.
Well, your ankles are swollen, and your breathing still seems a bit labored, even at rest.
Yeah, I had swollen ankles, and I was panting all the time when I was this big with Ryan, too. Just ask my ex. Oh, wait, he's nowhere to be found.
Well, these all could be symptoms of third trimester pregnancy, I agree, but I'd still like to do a full workup just to be safe.
I've got an appointment with my OB on Monday.
I'd really prefer if we could just check you out now.
Mom, look at this text you got from Moscato. It says as long as I get back before lunch is over, I won't mess up my record. So let the doctor run all the tests and stuff, please.
Okay, yes, run all the tests and stuff. Hey, I'm just fine. We'll make sure your baby sister is feeling good, okay?
Dr. Archer, Kurt Ledger scans are up.
Yeah, unstable burst fracture T12 from the fall today.
What?
Well, it isn't a medical miracle. He's got feeling below T10.
What do you mean?
No evidence of prior trauma at the vertebra. Yeah. This guy's not paralyzed. Kurt, wanted to review your imaging. To start with, you don't have an injury at T10. I'm guessing this isn't news to you. Do I need to repeat that?
I didn't think the scans...
What? Blow your cover? Okay, but what's really pressing?
I'm not trying to get disability benefits or better parking. That's not why.
Sure, of course.
I don't want you to think...
Hey, it really doesn't matter what I think. What does matter, your tumble today caused an unstable burst fracture in your T12 vertebra. And that's going to require surgery to fix.
And without surgery.
There really is not another option. If your fracture was stable, I would say you can try a brace.
No, I'm not asking about other options. If I don't treat this, what will happen?
You are going to end up actually needing a wheelchair. You're going to be looking at weeks in bed. Chronic back pain, weakness in one or both of your legs, numbness, even paralysis.
I don't want the surgery.
So I really appreciate your giving me access to your psychiatric record. It's very helpful.
Of course.
How about I just, give you my understanding of what I read, and then you let me know if I've missed anything. That sound okay? All right, so you were diagnosed with body integrity identity disorder 8 years ago, but experienced symptoms from early childhood.
Yeah, since I was at least 5, yeah.
And for you, BID presents itself in the form of a very strong desire to be paralyzed.
It's all I think about. It dominates every aspect of my life.
But it seems like the wheelchair gave you some relief.
Some, but I can still feel my legs. And for reasons I can't explain, that's an extremely distressing feeling. I've had therapists tell me it's due to repressed childhood trauma, neurologists who think it's a glitch in my cerebral cortex. A psychic told me it was linked to a past life.
Right. Yeah, I can see that you've tried a number of different therapeutic approaches here. Cognitive behavioral therapy, antidepressants, muscle relaxants.
Even hypnosis. Nothing's worked.
I wish I had something special in my toolkit for you, but frankly, these are all the therapies I would recommend myself. Must be very frustrating for you.
Yeah. And honestly, today's the most hopeful I felt in a really long time.
I want the tests.
Okay. Hey, Grace, you got a sec? So I don't know if there's like a formal suggestion box during this pilot phase.
On the suggestion box, what's up?
New software. It included giant cell arteritis in my patient's differential.
Your patient with the headaches.
Exactly.
GCA is pretty rare. It presents in 5 out of every 10,000 people, I think.
And testing for it requires a number of expensive labs. The patient's insurance is going to cover it, but I don't like ordering unnecessary tests. I prefer to rule out horses before chasing zebras.
Of course, but you don't have to order the labs. The doctor can override any suggestion on the differential.
Right, but before the doctor can do that, the differentials are automatically uploaded to the patient's chart,
Which the patient can view in real time by logging into the online portal.
which my patient did. And now she's insisting I order all these unnecessary labs.
So your suggestion is to lose the automatic upload, which we can't, because when the patient signs the consent form, they're guaranteed access to the full results.
Ah, I see. Well, you know what? Better safe than sorry, right?
Yeah?
Absolutely. And it'll ease the patient's mind, too.
Well, let me know how it turns out.
Hello, Balin. Remember me, Maggie?
Phelan drove himself to the ED because he feels like his heart is pounding.
Sorry to hear that. You want to take a walk with me, okay? We're going right down here to 3. Thanks, Lee.
The CIA is following me. I think I saw one of them in the waiting area. I can't be sure because I was changing his appearance.
All right, I won't let anyone come into your room without your permission. Trina here